Okay, so I don't know about you guys, but none of those conditions sound very fun to me. So if there was a way for us to minimize developing these conditions, wouldn't we all want to do it? So let's find out what that thing might be to minimize developing them. It's exercise. Surprise. Um, Not only is this wonderful for mom, it has amazing benefits. We're going to be talking about them now. It also has amazing benefits for baby. So let's find out about some of those benefits now. So increasing your energy and mood and assisting with healthy sleep patterns. So both of these things vary greatly during the prenatal period due to hormones. So it's something that we want to keep as neutral as possible. Preventing excessive weight gain. So of course you do need to gain some amount of weight during pregnancy. That is necessity, but it can control the amount of weight that you gain to a healthy amount and control your metabolism so that you potentially return to your pre-pregnancy weight a little bit quicker. Improving your posture. So not only will pregnancy increase certain risks of conditions, but it's also going to place strain on certain areas of your body. And we want to counteract that as much as possible with exercise. So doing that will have you feeling a lot better and a lot taller as well. The last point, muscle tone, strength, and endurance. So all of this stuff, it's going to help you function really well through pregnancy. But not only that, it's going to help you in the laboring process as well and potentially help you to have a more comfortable labor. And we're going to find out a little bit more. We're going to talk a little bit more about that on the next slide. So improving your ability to cope with labor. When you're exercising, you are subjecting your body to positive little mini shocks or stresses. So these things can prepare you a little bit better for the slightly larger shock of labor and can help prepare baby as well, because baby is also experiencing those little mini shocks at the same time as you. A reduced risk of physical complaints like low back pain and pelvic girdle pain. So this is stuff we're seeing in clinic all the time, not just with pregnant people, but non-pregnant people as well, especially during the pandemic, because everyone is sitting so much. And I'm sure some of you can relate to that as well. Exercise can help reduce these complaints, and that's a wonderful thing for on our end. Preventing gestational glucose intolerance and pregnancy-induced hypertension. 10 years ago, we had no idea that we could prevent conditions like this. They were just conditions that were thought to potentially occur to certain populations in pregnancy. And now we know that we can. And that's all really, really good news for us. And it's more motivation for us to do some exercise during pregnancy. Next slide, please. Yes, so the Canadian Society for Exercise Physiology states that prenatal physical activity should be considered a frontline therapy for reducing the risk of pregnancy-related complication and enhancing maternal, physical, as well as mental health. So this is a very different time, guys, that we're living through. It's a pandemic. It has forced everyone indoors, but it doesn't mean that it has forced us to stop moving. We need to keep moving, as now we have seen, not just for our health, but for the health of our babies and for the health of future generations as well. So that's just one of the reasons why we have come together to do this webinar today. Next slide. Okay, so this is a question we get in clinic quite often. Is exercise safe for all pregnant women? So for the most part, yes, all pregnant women with an uncomplicated pregnancy can participate in physical activity. However, if you have a complicated pregnancy, you probably should consult with your perinatal healthcare provider prior to be cleared for exercise. And we're going to be chatting about complicated pregnancies in a bit. So what is considered complicated? Being pregnant with multiples, that's considered a complicated pregnancy. Preeclampsia, or in other words, pregnancy-induced high blood pressure, also considered complicated. Placenta previa after 26 weeks, high risk of preterm labor or ruptured membranes. Pre-existing medical conditions, of course, like high blood pressure, diabetes, lung, kidney, or heart problems. Now, if you're looking at this list and none of this is you, but you're still unsure about commencing exercise during your pregnancy, I would still encourage you to speak with your OBGYN or your midwife prior to commencing, just to get a little bit of that reassurance. I'm going to pass it over to Alana now. She's going to be talking about the nitty-gritty of tonight, when and how to start exercising.
Yes, so two very common questions we get a lot in clinic. When do I start and how do I start exercising when pregnant? So the best time to start is typically in the second trimester. And this is because, you know, the nausea, the vomiting, the profound fatigue that you feel in the first trimester typically has passed. And the more physical constraints in the later stages of pregnancy have not started yet. So this is kind of the window where most people find is the best time that they want to start exercising again. And I will say this is not set in stone. Every woman is different. Some people have an awesome first trimester. They feel great. And if that's the case, they can definitely continue exercising. But what we see a lot and very commonly, people typically find the second trimester is the best time to start.